Welcome to the Senior Safety Advice Podcast, where we share practical tips and trusted guidance to help older adults live safely, comfortably, and confidently at home. I'm Robin Schiltz, Senior Home Safety Specialist, and I'm happy you're joining me today. In this episode, we're talking about a health issue that can sneak up quickly, but is often easy to prevent, and that is dehydration. For more helpful resources, be sure to visit us at seniorsafetyadvice.com. So, have you ever noticed that a loved one just seems to be a little bit off that particular day? Maybe they're more tired than usual, or maybe they're confused or irritable, or just not acting like themselves. Sometimes families assume it's simply aging, poor sleep, or the person's having a bad day. But there could be another explanation. They could be dehydrated. Many people picture dehydration as something that happens after intense exercise or spending hours in the hot sun. And yes, while that can certainly happen, older adults can become dehydrated even while sitting comfortably at home. In fact, dehydration is one of the most common reasons older adults end up needing medical attention. The challenge is that the warning signs are often subtle. One reason dehydration is so common in seniors is that our bodies change as we age. Older adults naturally have less water in their bodies than younger people. At the same time, the sensation of thirst often becomes weaker, and that means many seniors simply don't feel thirsty even when their bodies need fluid. Some medications can make this situation worse as well. Diuretics, certain blood pressure medications, and some medications used for heart conditions can increase fluid loss. Health conditions themselves can also play a role. Diabetes, kidney problems, illnesses that cause fever, vomiting, or diarrhea, all of these can increase the risk of dehydration. The result is that dehydration can develop gradually without anyone noticing. Now, one of the earliest warning signs is typically fatigue. A loved one might seem unusually tired or low on energy. They may want to nap more frequently or avoid activities they normally enjoy. Another common sign is a dry mouth or dry lips. You may notice frequent lip licking, complaints of a dry throat, or difficulty swallowing certain foods. Sometimes the signs show up in the bathroom. Urine that is darker than normal can be a clue that the body's not getting enough fluids, and less frequent urination can also be a warning sign. Changes in thinking and behavior are especially important to watch out for. A normally alert parent may seem confused, forgetful, or distracted. They may have trouble following conversations or become unusually irritable. This is one reason dehydration is sometimes mistaken for worsening dementia. Families may become alarmed by sudden confusion when the real issue is that the person simply needs fluids and medical attention. Dizziness is another important warning sign. If your loved one feels lightheaded when standing up, appears unsteady when walking, or reports feeling weak, dehydration may be contributing to the problem. And that brings us to one of the biggest concerns, and that is falling. Even mild dehydration can affect balance, blood pressure, and concentration. When those things are affected, fall risk increases. A simple lack of fluids can sometimes become a serious safety issue. There are also a few signs that dehydration may be becoming more severe, and those are sunken eyes, a rapid heartbeat, extreme weakness, inability to stay awake, severe confusion, or fainting. None of these should ever be ignored. If you notice these symptoms, seek medical attention promptly. All right, let's talk now about prevention. One of the simplest things caregivers can do is to encourage regular drinking throughout the day. Don't wait for someone to say they're thirsty. Instead, make fluids part of a daily routine. A glass of water with medications, a drink during meals, a favorite beverage during afternoon TV time. Small amounts consumed consistently often work better than trying to drink a large amount all at once. It's also helpful to offer variety. Not everyone enjoys plain water. Some older adults prefer flavored water, herbal tea, milk, broth, or diluted fruit juice. Foods with high water content can help as well. Watermelon, oranges, grapes, cucumbers, tomatoes, soups, and yogurt all contribute to hydration. You want to pay extra attention during hot weather, too. When temperatures rise, fluid needs often increase. Even staying indoors doesn't completely eliminate the risk. Air conditioning helps, but seniors can still become dehydrated if they are not drinking enough. If your loved one already has memory problems, visual reminders can make a big difference. Keep a water bottle nearby, place drinks where they're easy to see, use simple reminders or routines that encourage sipping throughout the day. For some people, keeping a favorite cup or a tumbler within easy reach makes them more likely to drink regularly. I know for myself, I have a big mug and I fill it with water and keep it on my desk and just sip it throughout the day. But if it wasn't there, I would forget about it and I just wouldn't even think to drink until I really was thirsty. So it does help to have something in view. As caregivers, it's also important to trust your instincts. You know your loved one better than anyone. If something seems different, or if they seem weaker, more confused, more tired, or less steady than usual, don't dismiss it. Ask yourself a simple question. When was the last time they had something to drink? Sometimes that question leads to an easy solution. Of course, not every change is caused by dehydration. But because dehydration is so common and potentially serious and often preventable, it's always worth considering. The good news is that recognizing dehydration early can help prevent bigger problems later. A little awareness today may help avoid a fall, a hospitalization, or a medical emergency tomorrow. So the next time a loved one seems a little off, remember to think first about hydration. It's a simple step, but it can make a remarkable difference in health, safety, and quality of life. So thank you for spending a few minutes with me today on the Senior Safety Advice Podcast. I hope this episode helps you feel more confident in recognizing the warning signs of dehydration in yourself or someone you care about. For more senior safety tips, caregiving resources, and practical guidance, visit us at seniorsafetyadvice.com. And if you're looking for aging-in-place professionals in your area, be sure to explore our sister site at aginginplacedirectory.com. Don't forget to subscribe to our podcast or YouTube channel so you never miss an episode. Until next time, this is Robin Schiltz, wishing you safety, comfort, and confidence at home. Thanks for listening. Bye.